am your host, Piyusha Majumdar. And in this month of September, the medical community acknowledge, honor, and celebrate the significant contribution of women who are working in the field of medicine. And we are celebrating this month by having with us none other than Laura Magna, who's a stalwart of public health education and our main motivation for starting this podcast. Welcome to the show, Laura. She served as the president and CEO of the Association and Program of Public Health, working towards its mission to advance academic public health by mobilizing the collective power of our members to drive excellence and innovation in education. She was also a founding president of Global Network for Academic Public Health, a network of association of schools and programs of public health around the world. She's an inspiring and motivational leader with first-rate interpersonal skill and ability to move organization forward, leveraging individual strength and capability. So since I started this podcast, I've always wanted to record an episode with her, and today we got the opportunity to do so. Thank you, Laura, for coming to our show. And today we are recording a podcast on Public Health 4.0. So, can you tell us what defines Public Health 4.0 and how does it differ from earlier model of public health?
Absolutely. First of all, thank you so much for having me here. It's a true honor and privilege to be with you, with your audience. You have done really an incredible job to really, make very important points about public health. So thank you so much for everything that you're doing. It's really my privilege to be in this podcast. Thank you for the invitation, Piyush. So what defines public health for all? So to really understand public health for all, we need to zoom out. Public health has gone through really distant phases, right? Each shaped by society's needs, of course, and the tools available at the time. So let's recall a little bit the beginning. Public Health 1.0 began in the late 19th and maybe early 20th centuries, focusing on sanitation, clean water, and infectious disease control. So it was about infrastructure and actually survival, really. Then Public Health 2.0. So came mid 20th century with really scientific breakthroughs, vaccines, antibiotics, stronger health systems. Evidence-based epidemiology really became the backbone of policy. And then over the years, we started the Public Health 3.0. In the early 21st century, really expanded beyond medicine. It recognized the importance of social determinants of health, which in public health, we work a lot, like housing, education, income, and call for really cross-sector collaboration. Digital health systems really began to take shape at that time. But now we're here, Public Health 4.0. So this marks a paradigm shift. So it's really proactive, it's digitally empowered, equity focused, extremely important. And it's built to be resilient in the face of really all the global challenges that everyone is facing right now, pandemics, climate change, and really systemic inequities. So Public Health 4.0 is intersecting with the fifth industrial revolution that really centers people in the digital world. So very exciting time that you, me, and all the audience we're living right now in public health.
Very, very true and very interesting to know that. Okay, tell us how has the role of technology, especially when it comes to big data, digital health tools, because we're using these things, how it has evolved in shaping Public Health 4.0.
So think about it. AI systems that can detect outbreaks even before they happen. Wearables that monitor our health in real time. Geographic information systems that map disease spread down to the neighborhood level. So let's just break it down because it's like too much, right? So technology and database innovations are really central to public health 4.0. It's really what defines 4.0 is all these advancements that in an everyday basis we're seeing in our world. So let's just go and review some of them. Let's just start thinking about big data and AI, for example, which now is a big thing, right? So be what all these tools are doing right now? Number one, they are enhancing, or one of the areas, surveillance and outbreak detection, which is a very exciting thing for public health, right? These big data and AI are enabling processing of really massive data from across various sources in real time, predicting, modeling outbreaks, health trends, heat waves, right? Precision public health, precision medicine, allowing really for faster interventions and containments. So big data and AI really enable in real time all the surveillance that we need. We need to predict the models in order to really prevent diseases, right? That's one thing. Another area is optimizing the resource allocation. So AI models, if used correctly, they can really predict. They can really use it for the demographic, really to have demographic data and include all that data in order to make decisions, that's the most important thing, right? In order to collect all this data in real time in order to make the correct decisions. So that's another area. Another area that I would like to comment is how about diagnostic, like improve the diagnostic and really the personalized medicine. So AI really assists in this, in medical image analysis. They are faster, they are more accurate, identifies individuals really at high risk, for example, for chronic conditions. They support personalized treatments, plans, preventive care, of course. So this is the real promise of AI, right? Really to personalize medicine, but at the population scale. We need to close the gap between clinical medicine and public health because that's where we are, right? And we want the population scale. So the challenge is really ensuring that all the social determinants don't get really codified into just AI models, but thereby it could actually exacerbate inequities in the digital space, and we're totally against that. We really wanted to use it in the favor of getting to know all the social determinants and use them in order to really be having better interventions. Another area that's very important to us that we are in academia is the accelerating part in research and development because availability of massive databases allows all of us and all of the researchers for more extensive clinical trials, drug discovery, and research into really the new diseases and treatments, right? Speeding up innovation in health. Another area is the geospatial technologies, right? Which is just like even beyond our planet in order to really capture images of our planet. So these tools really help map diseases spread around the planet. And also, we need to use these in order to identify where are the health inequalities in a very granular level, to have precision in order to really have, the interventions. And lastly, the last part that I would say, because I say it's just so fascinating topic that we can talk a lot of different things. But the digital tools, the for health, right? So, for example, the mobile health, the app, the wearables, the remote monitoring devices, right? That support personal health management and early detection, intervention. All of that, it's happening. It's happening quick, very fast. And of course, we see a lot of development in the area of telemedicine, telehealth. We have been able to really reach very remote communities and be very precise in the diagnostic and the treatment just because we are using and every day more all the schools and programs of public health and medicine are using telemedicine and telehealth in order to reach all these communities. So that's very exciting. So all of that, and of course, in a every day basis, you and me and many people are using the chatbots, right? AI chatbots are now, it's part of our daily job. That are helping us in order to take notes, have summaries, more efficient, so we can really concentrate in the more important part of our work. And I just want to share that in ASPPH, which is the Association, as you said, of Schools and Programs of Public Health. We're based in Washington, D.C., but we have members in 7 different countries, and we really work around the world. We have a partner with one of the IT companies in order to develop ARI. ARI is a public health chatbot. And ARI is helping us to develop really all the information, the database for really the sources that we want this chatbot to go first in order for our research and our decision making process will be more precise about the information that we want. So I'm really hoping that all of you go into our website and get to know ERI, which is our chatbot for public health, and we want to really enrich more, of course, the generative AI space. But just to give you some examples, I know it's too much. Every single part of these things that I have mentioned has, a lot to discuss. But I hope I gave you like just the spirit of what is happening, the excitement of the current moment.
Right, right. I mean, very exciting to know. What, according to you, is the most promising innovations, or technology, especially on the horizon for public health 4.0?
Oh, wow. Well, there's a lot. I think that the future is for us to create it. I believe that the future is nothing that it's not that we are discovering the future, it's more like we're creating the future. And that's very exciting because it depends on how we are using the tools that we have right now. So, for example, if we think about education, which is, of course, my field, and academic is our field of action. So, for example, predictive models to learning. So we can now predict if the students are going to be able to finish their degrees, what are the areas that are weak, so we can strengthen the curriculum in that area. We can actually use it, for example, for lifelong learning. So we can predict the new jobs, which that's in itself a huge challenge, right? But we can do that right now with the tools that we have at hand. And we're using that, and then we can be more effective, more efficient. One thing that I'm very excited is that if used it correctly, we can really even shorten the gap that we have right now in terms of education, in terms of health, because we can really go and reach very remote communities if we use well the AI. So there's a lot of these things happening. We are testing right now. We are piloting right now in public health, in medicine, all this, and we're learning. I mean, actually, we're learning right now, what are the potentials. But I think that every single day, it's a new thing. It's a new discovery. There is, okay, let's try this to see what's going on. So I think that everything related to predictive models, which is going to be huge, because if we can predict really, outbreaks in applied public health, the outbreaks and things like that, but in education, if we can really be more savvy in terms of the competencies, the curriculum that needs to happen in academic public health, in academic medicine, that will be a great success.
Right. What do you think? Like, the digitalization is happening, but we have, public health workforce. What do you think? How, the public health workforce can adapt to the challenges or the opportunity of digitalization, because it's new for them as well?
Oh, absolutely. Thank you for that question. That's a great question, just because we work a lot with our workforce. So the public health workforce, of course, they must evolve. The same as public health has evolved, as I explained at the beginning in these 4 stages, the workforce has to evolve as well. They have to really change the mindset from that sanitation perspective, which, by the way, we should keep doing that. It's not like we are, forgetting that and just no. We're just adding. That's the tricky thing, and that's the challenge. We're adding competencies and skills to our workforce, but the workforce has to really evolve in several key areas right now that blend, of course, their technical expertise, the ethical right now, because now the more we know about all these tools, the more it's important to really rely on ethics and the ethical way of using all these tools. And of course, we need to be always being community-centered skills. So just tapping into some of these areas that the workforce has to really evolve and upskill. One of them, definitely digital and data literacy, especially because that was not like part of our curriculum like 20 years ago, right? So digital and data literacy, really we need more training in data analytics, in GIS, in AI, of course, in cybersecurity, informatics is essential, no? We need to master some platforms, right? Maybe new to some of us, like, I don't know, Python and Tableau, cloud-based tools, all of that. So one part is this technical, right? But the other thing is that we need to continue because we do that very well, but we need to continue working interdisciplinary, right? Because every day, the world, the problems, the challenges are showing us that we need to collaborate more across technology, communication, behavioral science, policy domains. So and even beyond that. So in one hand, we will need to be more interconnected with our family, which is the health professional family, but even beyond that family are now all the people in economics, all the people in technology, in other disciplines that we need to really understand more their fields and work together. Of course, the ethical part, the legal awareness is extremely important, has become more important in our profession. So we need to understand privacy. We need to understand bias, data ethics, algorithms, and how these we can use it responsible in AI use in governance. And by the way, we are working on that right now. We are putting together a framework ethics in the responsible use of AI here in ASPPH because we find out that we need those guidelines, right? Other important skills there for the workforce, like change management, right? Now every single day is just a new thing. So we need to be able to really pivot and to really be changing all the time. So how do you do that? And of course, without forgetting our most important part of our education, which are the so-called the soft skills that for me are the most important one, are the professional skills, are the interrelational skills. So we need to be able to be resilient, to have empathy, to cultivate empathy, to be effective communicators. All of that is extremely important in our days. So everything related to the community engagement, we need to continue emphasizing the work with the community. And of course, designing always equity-based strategies. So we need really professionals who are just really comfortable at using all these new digital tools at the same time that are very comfortable working in with the community and on the ground. No? So this ability to adapt quickly is extremely important, the same as the other. So yes, I think the workforce. I know that maybe it's too much to ask to them, but that's our reality, and we need to concentrate in those skills and those competencies that really you're gonna carry out along your career.
You're right. While I was listening to you, I was thinking about, when we work in public health. So it's very, very important that, we should communicate the right public health information. But in this digital age, we know that, there are a lot of misinformation and all these things happening. So what do you think? What are the best practices for communicating this public health information in today's digital age? Because we also have to combat our misinformation and also build trust among the community.
Wow, that's a great question. That's a great challenge. That's something that in an everyday basis we all work for. because one of our responsibilities is actually to be able to communicate to the policymakers, to the community, to everyone in order to really advance. And right now, that's an area that has been really challenged all of us. So a few things I think for all of us, so just to remember and to be working with in order to really face misinformation or disinformation. So one thing that I think is extremely important is transparency and speed. So timely, accurate information really, I think that reduces the vacuum in which sometimes misinformation thrives. We need to use real-time like dashboards, right? And we need to always be honest. Sometimes, and I'm just remembering the vaccine, the pandemic times, when the information was the science was changing all the time, but we need to say so to the community, like with the evidence that I have now, the best practice is doing X, Z, right? But maybe tomorrow that science already evolved, and now you need to do something else. Sometimes if we are not honest about that, people tend to think that we change all the time, and that's why I don't trust you because you say one thing today, tomorrow another thing. But we are people that are based our decisions in science, and we need to say it more. So one thing is that, like the transparency, the speed, we need to be there. And here, I think it's an important lesson for all of us, all of the researchers, the professionals, and public health professionals, because we always tend to publish all our research in all the journals, professional journals, and that's a good thing. We need to keep on doing that. But of course, the policy makers and the community would not read those, papers, those journals. They want very, concise, rapid, one paragraph. What do you mean with that research, right? So we need to also be able to communicate our findings to the community, to the policymakers, and we need to practice more that. And by doing that, we need to use plain language, not the language that we used to do, but more plain language. In storytelling, that's something that we are right now trying to push more. We need to use more like infographics, videos, really interactive dashboards, really to explain complex health topics more clearly, more really down to earth, something with the language that everybody will understand. No? If we focus on storytelling, I think we are humanizing really our challenges, right? Because we are creating the discourse with what does that mean to real people. So we need to do more, and I know that you're very good at that, and that's something that we need to learn from all of you. I think that there are cultures that pay more attention to storytelling, and if we think about our ancestors, they were awesome at storytelling. The stories that you heard from your grand. I was thinking from my abuela, which was my grandmother, right? Your ancestors just pass these stories to storytelling, and those stories are keeping in your mind as right now. It's really they really impact. So one of the things that we are trying to do right now in Academy of Public Health is let's tell more stories. Let's bring the faces of the people to the policymakers, to the community in general, in order to make sure we all understand the impact of public health. Another area that I think it's important in terms of communication is tailoring messaging, because sometimes we send one message and we think that everybody understands that message. So I think that one of the things that all of us need to learn, all our students and graduates, and of course the workforce, is like, how do you put that message in different formats? Is it the same message, or is it different formats depending on the audience? So we need to be more acquainted with doing that, and of course, in multimodal formats, because not everyone gets their information or their news from the newspaper or the radio, social media, but maybe so every format that we can use, every medium that we can use, it's extremely important. And one last thing, and I'm sorry, that's just so much that I want to say, but one other important thing that is really extremely important right now in terms of communication is we need to find new messages and new messengers, because we used to do the traditional messengers, and we all, of course, we all give the messages of public health, why you need to mask, why you need to vaccine, all of that. And that's we need to keep on doing that. But we need to find new messages. What are the people who our community are listening to? What are the messengers in the community? The different religion leaders, for example, the different community, the supermarket, the market, the sports. What are the other audiences there we are not reaching? And maybe new messengers that with our messages, and if we are much centered in the people and storytelling, hopefully it will really increase the level of communication with the community and eventually, of course, also with the policymakers. So a lot, but just to, I think all of the questions that you have just said, it's just like fascinating to me, fascinating topics, because all of that is happening as we speak, Piyusha. So the more we talk about these things in public health, the more we become aware of these things and we can do something about it. So thank you for all those questions. So interesting.
Thank you so much, Laura. And I got mesmerized when I was hearing, how public health, 4.0 can transform this entire public health domain, and what we can, do to contribute towards public health 4.0. Thank you so much for giving your time to us. Any last message for our students who are studying public health here?
Yeah, maybe I would like just to close just by saying that really Public Health 4.0 isn't just about new tools, right? It's really about a new mindset. So we really need to cultivate that mindset in our students, in our schools of public health. So instead of designing health intervention for communities, we are co-creators with the community. So we need to be with the community in order to co-create really the world that they need, the environment that all our communities need in order to thrive. So we need to change that like top down model that we used to have to be more really conversational, more engaging with the public that listens. We need to learn to listen more than we speak. And I know that I have spoken a lot, but listen is a great skill that we need to have in order to really center everything we do in the community, and of course health equity, which has to be really on the center of everything. So I just want to finish maybe by the message of the importance of co-creating solutions for our community and with our community, really empower us with the digital world, which is exciting everything that's happening is for us to use it, to explore it, to pilot, to learn, and just to evolve with it. And everything has to be really culturally tailored, right, to whatever the communities we are. So we can speak at the global level, at the regional, but very important community-based interventions, or using all the social media, the community platforms, and everything we can in order to pass our message. So with that, thank you so much. I have enjoyed so much this time with you, Piyusha.
Thank you so much, Laura. Thank you so much. And I really looking forward to have you some other day in India to meet you.
Absolutely. I would love to. I would love to. Looking forward for that. Thank you so much.
Thank you. Thank you so much, dear. Thank you so much for coming. Bye bye.
Thank you. Goodbye now.